Hello and welcome to Dr. B.R. Ambedkar Open University. Today we are here to speak about the most sensitive and essential elements of healthcare. Our topic today is about the end-of-life communication, which is also a part of MBA HHCM program. HHCM, which stands for Hospital and Healthcare Management, and this topic is for the first year, first semester students. And the topic is from block 2, that is about technology and communication, and the subject name is communication skills for managers. Before we go on to the topic, I would like to ask you a question: why people find it difficult to talk about death? Many of them avoid it because of fear, anxiety and emotional pain. However, an open communication about end of life helps a patient to reduce fear, sadness. It also enhances peace and comfort at the end of life. Our topic today is closely related to this question, that is the end of life communication. Now we shall be discussing about the meaning of end of life communication. What do you mean by end of life communication? End of life communication is the conversation which takes place between a healthcare professional, a patient and their family members when the patient is nearing the end of life. The prime objective or the purpose of initiating such conversation is to ensure that the patient's wishes, values and preferences regarding the treatment options and care are properly understood and respected. It involves discussing on topics like the treatment options, the prognosis, the diagnosis. We shall also be discussing about pain management, comfort and care. Besides this, a patient's spiritual and emotional needs are also. The end of life communication promotes patient-centered care, as the main objective of end of life communication is to focus on the wishes, values and preferences and the treatment options of the patients. This will help the patient to express their wishes regarding the treatment option. For example, to make sure that the patient wants to go for a aggressive therapy or a palliative care or a home-based care or hospice care. This will also ensure that the medical decisions are being taken with patient rather than for the patient. Secondly, the end of life communication also helps to enhance comfort and dignity, as the healthcare providers, when they talk to the patients regarding the treatment options honestly, this will help the patients to go for comfort measures like pain relief and emotional support rather than going for unnecessary invasive treatments. This approach also helps a patient to spend his last days with dignity, comfort and care. Next is the end of life communication also helps to build trust and reduce anxiety. A transparent communication about end of life also helps the patients and the family members to build trust in the healthcare team, as the family members are well informed about the medical decisions, about the prognosis. Prognosis is the possible outcome of a disease. Then they feel less distress and that it avoids confusion. Next is the end of life communication also helps to improve decision making. A good communication about the end of life also helps the family members to take in decision making, like for example, if they have to make a decision as to withdraw the ventilator support or not. For example, when a doctor talking to the family members of a patient who is unconscious and who is put on a life support, then the doctor helps the family members to take an informed decision about withdrawing the health support as per the wishes of the patients which he expressed previously. The end of life communication also helps to prevent conflict and misunderstanding. A proper effective end of life communication also helps to prevent conflict and misunderstandings among the family members, especially when there is any disagreement about the treatment options. This also helps the families to take a mutual decision regarding the treatment. The end of life communication also strengthens the role of the healthcare team. An effective end of life communication needs lots of training, coordination, and confidence in handling sensitive situations. The healthcare team, this will help the healthcare team to improve ethical and compassionate decision making in the healthcare. Now we shall be discussing about the goals of end of life communication. The first important goal of end of life communication is to understand the patient's wishes, like the choice of treatment, the preference of place of care, the resuscitation decisions. The choice of treatment, as in talking to a patient politely and asking them whether they want to go for an aggressive therapy or they want to go for a palliative care or home based care or hospice care. Preferred place of care, for example, a social worker talking to a patient regarding the advanced care plan, he comes to know that the patient is would like to prefer to die in home surrounded by their family members rather than dying in an hospital ICU surrounded by machines and medical procedures. Resuscitation decisions, for example, when a patient suffering from heart disease, when he is admitted into the hospital, let's say he is signing DNR orders, that means he don't want the resuscitation to be performed when his heart stops beating. The next important goal of end of life communication is discussing treatment options and prognosis. For example, a doctor talking to a 85-year-old patient who is on dialysis, the doctor says that going for further dialysis can help the patient kidneys, but it also cause him weakness and frequent hospital visits. The doctor says that the another option is to stop dialysis and focus on comfort care at home. The next objective of end of life communication is planning for comfort and care. Planning for comfort and care can be achieved by pain management, by talking to the patient about the benefits of home based care, and by reducing unnecessary procedures. It can also be achieved by creating a peaceful environment and encouraging the patient about his emotional and spiritual supports. For example, when a patient is nearing the end of life, though he is not religious in his whole life, but at the end of life he becomes religious and he tries to maintain a rapport with the God. He may have some spiritual wishes, like he would like to meet his priest before he is going to die, or sometimes he may ask the healthcare providers to perform some rituals which are very important in their religion before he is going to die. Now we shall be discussing about the key principles of effective end of life communication. The first important key principle of effective end of life communication is about honesty and empathy. As the care providers, they talk about treatment options to the patients honestly. This will help the patient to go for comfort measures, like about the pain relief or about the emotional support, rather than going for unnecessary invasive treatments. Next is empathy. Empathy is putting yourself in the position of the patient. Empathy helps to understand the situation of the patient more clearly. It also helps a healthcare team to understand what kind of a pain a patient is going through. The second principle of end of life communication is using a clear and simple language. As the patient nearing the end of life, he has already fear, sadness and anxiety. So using a simple and clear language can help the patient ease his pain. It also helps to improve the comfort. Thereby it also helps to improve the patient satisfaction. The next principle of effective end of life communication is showing respect for culture and personal values. Showing respect for cultural and personal values also acts key principles in making an end of life communication effective. The cultural values, like for example, the patient may express his wish that he would like to perform some rituals which are very important in their religion before he is going to die. The personal values are like, for example, some patients may insist on providing same gender caretakers. The last principle of effective end of life communication is about active listening and compassion. Active listening is very important. Active listening helps avoid misunderstanding in the communication process. Active listening also helps rapport building between patient and the healthcare team. It also supports the patient member to involve in the communication process. Compassion helps a patient reduce his emotional stress. Compassion also helps a patient to improve the patient satisfaction. End of life communication conversation can be initiated when the illness becomes terminal, when the doctor comes to know that the disease has come to the final stage. For example, a doctor talking to a terminal cancer patient about the limited benefits of going further chemotherapy. The doctor also discuss about the options for going for palliative care or home based care or a hospice care. The another examples of the disease when it becomes terminal is a person suffering from congestive heart disease, where the heart fails to pump because the arteries are blocked. The another example are like people suffering from chronic obstructive pulmonary disease. The other circumstances to initiate the end of life conversation is when the treatment options are limited. When a person suffering from some kind of disease where the treatment is limited. Next is when we observe that the patient is being hospitalized for multiple times for the same issue, then also it is the right time to initiate the conversation of end of life communication. Other situations are like when the patient express his emotional and spiritual concerns, then also it is the right time to initiate the conversation of end of life communications. When the patient or family is requesting about the information or ask about the prognosis, when the family members they talk about prognosis, the prognosis is what is the possible outcome of a disease in future. It is also a right time to initiate the conversation of end of life communication. Lastly, when we observe any functional decline in the patient's behavior, like for example, when the patient is nearing the end of life, he may have fatigue, he may have nausea, he may have difficulty in drinking, difficulty in swallowing things, then it is the right time to initiate the conversation of end of life communication. Now we shall be discussing about the various participants in the process of communication. The first one is doctor and the physician. The doctor and the physician, they act as the primary participation in the process of end of life communication, because they leads discussion about the patient's diagnosis, prognosis and treatment option. They also explain medical information in clear, honest and passionate language. The doctors and physicians also guides decisions on whether to continue or stop an aggressive treatment. They also ensure that the patient wishes are documented and respected. Next, the second participant in the end of life communication are nurses. The nurses acts as a bridge between the patient, family and the doctors. They provide emotional support and comfort and continuous care. The nurses also observe patients' physical and emotional changes and communicates the same to the healthcare team. The nurses often help family members understand the complex technical terms used in medical field, and they try to explain these things to the family in simple language. The third participant in end of life communication is the patient. The patient acts as the central participant in the process of communication because the entire decisions is being taken depending upon the wishes, values and preferences of the patient. The patient also has the right to accept or refusal of treatment. The patient shares their goal for care such as pain relief, spiritual peace or staying at home. For example, the patient says, I want to be comfortable at home with my family instead of staying in ICU. The next participant in the process of end of life communication is family members and caregivers. Family members and caregivers, they often offer emotional, spiritual and physical support to the patient. They also help communicate the patient wishes when the patient cannot. They also participate in decision making and care planning. The next participant in the process of end of life communication are spiritual or religious counselors. Spiritual and religious counselors, they provide spiritual comfort and guidance according to the patient's faith and beliefs. They also help the patient find peace, forgiveness and meaning at the end of life. For example, a chaplain prays with the patient and family, offering emotional strength and hope. Who is a chaplain? Chaplain is a religious priest who is appointed in a hospital or in an institution or in an association or an organization. The last participant in the process of end of life communication is the psychologist or the counselor. The psychologist or the counselor supports the patient and family in dealing with anxiety, depression or fear. They also help them express feelings and prepare them emotionally for death. For example, a counselor helps a patient cope with fear of dying and also guides the family through the anticipatory brief. Now we shall be discussing about the communication techniques which makes the end of life communication effective. The first important technique of end of life communication is to use open-ended questions. Open-ended questions help us to understand the situation more clearly rather than using close-ended questions which can help us to get the concise information about the situation. So, while talking to the patient, we use words like how, what, when and where which helps us to paraphrase the situation. The second important technique of communication is allowing silence and emotional expression. Next is about acknowledging feelings. Acknowledging feelings of the patient helps the patient to build rapport with the healthcare team. They also help the patient to improve patient satisfaction and reduce the emotional stress they are going through. The last technique of effective communication is providing clear explanation about care options. Now we shall be discussing about ethical consideration. The few important ethical considerations while initiating the process of communication is like respecting the patient's autonomy and privacy, truth telling and informed consent, and maintaining confidentiality, avoiding unnecessary interventions. Now we shall be talking about the barriers to effective communication. The first important barrier of effective communication is fear of upsetting the patient. In most of the situation, the healthcare team, they hesitate to talk to the patient because of fear of upsetting the patient, because a patient who is nearing the end of life, he is already suffering from emotional concerns like fear, sadness, and emotional pain that they are losing their loved ones. The second barrier to effective communication is lack of time or training. Initiating a process of effective communication effective communication process requires lot of training, like how to initiate the process, when to initiate, what to talk and what not to talk. The next barrier to effective communication is about culture or language differences. Sometimes the healthcare team, they find it difficult to talk to the patient because of cultural and language barriers. The last barrier to effective communication is about family denial or conflict. Sometimes the family members, they don't think it's appropriate to initiate the process of end of life communication, because this will face them about the emotional pain they are going through when they think of losing their loved ones. Now we shall be discussing about the barriers to overcome. Now we will be discussing about the overcoming barriers. Now we shall be discussing about the barriers to effective communication. The first important barrier of effective communication is fear of upsetting the patients. In most cases, it is found that the healthcare team, they hesitate to talk to the patient in a fear that they are upsetting the patient, because a patient who is near the end of life, he's already suffering from sadness, anxiety and depression, so they feel that it is not comfortable to talk to them. The second important barrier of effective communication is lack of time or training. An effective end of life communication needs lot of training and time management in the healthcare team, so this will act as a barrier. The other barriers to effective communication is like culture or language differences. Sometimes the healthcare team, they fail to initiate the process of end of life communication because of culture difference and language differences between the healthcare team and the patient. The last barrier of effective communication is the family denial or conflict. Sometimes the family members, they don't prefer to talk about end of life because they feel that this will distress them, this will increase the anxiety and depression among the family members and as well as the patient. They don't feel comfortable to talk about the end of life. Next is, now we are talking about overcoming barriers. The first important technique to overcome the barrier is providing training for healthcare staff. Providing a proper training to the healthcare staff, as in how to start an end of life communication, what not to talk and what to talk, and what is the proper timing of initiating the process of end of life communication. Next is to overcome the cultural or language differences. We can use translators or cultural mediators to initiate the process of end of life communication. In order to overcome the fear of upsetting the patient, we can help that by building trust through empathy. Family denial or conflict can be overcome by scheduling private conversations and quiet discussions, as the family members and patients, they don't want to discuss the end of life communication publicly. Next is about the role of healthcare professionals. The healthcare professionals guide patients and families with compassion. They also help clarify medical facts and options. The healthcare professionals also support emotional and spiritual needs. They also coordinate with the care team. Now we shall be discussing about the impact of good communication. An effective end of life communication helps to reduce fear, sadness. It also helps to improve patient satisfaction. It also helps the family members in difficult time. It also helps to develop ethical and compassionate decision making in the healthcare team. An effective end of life communication also helps to reduce emotional stress. It also helps to improve quality of life. It also helps to initiate the process to initiate the end of life communication peacefully and dignified end of life experience. Next is about the barriers to effective communication. The first important barrier in effective communication of end of life communication is fear of upsetting the patient. In most cases, it is observed that the healthcare team, they hesitate to initiate the process of end of life communication because they has a fear of upsetting the patient, because a patient who is nearing the end of life, he already has some emotional concerns like the fear of losing their loved ones, the anxiety and depression. The second important barrier in effective communication is lack of time or training. To initiate the process of end of life communication, it requires lot of training to the healthcare team. Training as in how to initiate the process of end of life communication, what are the things to be asked to the patient, and what are the things we should avoid when we are talking about the end of life, so that we make sure that the patient is at ease. It also helps to reduce the emotional distress of the patient. The timing is also very important in initiating the process of end of life communication. It is observed that some healthcare providers, they don't get the time to initiate the process of end of life communication. The second important barrier of effective end of life communication is the culture or the language differences. It is observed that in most cases, the doctors or the patients or the healthcare team, they fail to initiate the process of end of life communication because of culture and language barrier in the between the patient and the healthcare team. The last barrier of effective end of life communication is family denial or the conflict. Sometimes the family members, they don't feel the importance of initiating the end of life communication, because for them it makes them emotionally distressed, and even the patient, he's not ready to talk about the end of life. In such case, it is very difficult to initiate the process of end of life communication. Sometimes there will be there are some cases where there is a conflict between the family members and healthcare team as to not to initiate the process of end of life communication. The first important technique to overcome the barriers of end of life communication is providing a proper training to the healthcare staff, as it requires proper training to initiate the process of end of life communication. Proper training is given to the healthcare staff. The second important technique to overcome the barrier of end of life communication is using the translators or cultural mediators. This will help us to overcome cultural or language differences. When there is a difficulty in speaking to the patient because the patient did not understand the language of the healthcare team, sometimes we call the translators who will initiate the process of end of life communication on behalf of the healthcare team. The translators, they act as mediator between the healthcare team and the patient. The next important technique of overcoming the barriers of end of life communication is building trust through empathy. Empathy is very important. This will help the patient to build trust among the healthcare team. Empathy is putting yourself in the position of the patient. Putting yourself in the patient's place will help you understand the situation more clearly. It will also help us to understand what kind of a pain a patient is going through. It will also help us understand the spiritual and emotional concerns of a patient. Spiritual concerns, as in some patients, when they are nearing the end of life, they need some spiritual concerns, like they would like to perform some rituals which are very important in their religion. They want their priest to visit them before they die. The emotional concerns are like the fear of losing their loved ones and the sadness that they are going to leave this world, that can be addressed. The next important technique of overcoming barriers is to schedule the process of end of life communication privately and quiet discussions. This will help us avoid the barriers like the family denials or conflicts. This will help us to maintain the privacy of the patient by scheduling the conversation privately and by leading a quiet discussions. Now I would like to conclude the topic. The end of life communication is a vital part of healthcare. It ensures patients receive compassion, respectful and value based care at the final stage of life. I would like to end the session by referring a quote: "To care for those who once cared us is the highest honor." Thank you.